Hello everyone, we all have witnessed the worst part of this millennium, the COVID 19 that started in Wuhan, sprawling metropolis in China's hub, provided doctors started a strange and aggressive pneumonia. This did not respond to usual treatments. The first cases were loosely linked to the Wuhan and seafood wholesale market, a place teeming with life, both domestic and chaotic intersection of nature and human commerce. Here, virus made a fateful leap from an animal to human. It was a microscopic spore, 11 million and even imperceptible the virus. This was named SARS-CoV-2, moved in families and communities with stealthy efficiency. It hid inside bodies, replicating in dog before it. Symptoms and presence early on the official's narrative was out of control. It was just a handful of cases, easily contained. Dr. Li Minliang tried to warn his colleague about a new illness, SARS, for his efforts. He was reprimanded by local authorities for spreading lies and comments, and it simply spread as hospitals began to overflow with patients gasping for the air. The official story fractured by January 2020. Wuhan was sealed off. It was an unprecedented corridor of a major development, a desperate medieval tactic deployed in the 21st century. The lockdown turned a bustling city into a ghost town. Its empty streets were the spark it ignited, and it was about to learn the true terrifying nature of the blaze it had started. The age of COVID-19 had been. The virus was a seasoned traveler. It did not need passport, only a host. Every airplane became a potential, carrying the virus across ocean and continents in a matter of hours. It moved at the speed of human travel, exploiting the pathways we had built to bring ourselves closer to It was a parasite of our own success, exploiting our interconnected world. India, a nation with billions, watched first safely. The first case confirmed in February. Then from Wuhan University, a student came, and within weeks, numbers scaled. India felt insulated by the distance, but the virus was already weaving through society. It arrived. Tourists at Rajasthan palaces, business travels in Mumbai with returning citizens from across the globe, a silent patient infiltration. The moment of realization was dawning. Had the tickle became a stream, case emerged in desperate locations. No clear line of transmission. Communities spread it, moved invisibly, crowded market through bustling trains, stations, through close-knit family homes, where multiple genera. Together, the Indian government responded with one of the most stringent lockdowns in the world on March 24. With just 4 hours' notice, the entire nation was ordered to stay home. The decision was a colossal gamble, an attempt to stop the virus by halting the movement of an entire subcontinent. But it also triggered a humanitarian crisis for millions of migrant workers left without job, shelter in the cities. They began walking miles long to their villages on foot, and their journey was a tragic spectacle of humanity's miserable situation. Virus was no longer a threat. It had become a profound social catastrophe. Thermal screening was set up at airports as India was trying to crack the spread through lockdown. Overnight, families found trapped watching their world shrink to confines of their homes. Fear is just a virus, and it spreads much faster than any pathogen as COVID-19 swept across the globe. Pandemic of anxiety was more dangerous. Doorknobs standing in a grocery line, breathing the air in a room, potential act of danger, handshakes, hugs, crowded concerts, hustling cafes. The fabric of human connection was replaced by a landscape of uncertainty. People felt a profound sense of helplessness, trapped in their own homes, watching the number of sick and dead climb the screens. The constant barrage of information, often contradictory, confusing, filled to an anxiety. Was it safe to touch me? Could the virus live on surfaces of days? Did masks work? This helplessness was universal, a shared human experience that transcended from New York to remotest villages in India. To honor the healthcare workers, gratitude mixed with desperation was visible. Of Rio de Janeiro, communities felt abandoned, left to face the onslaught with little government support. The psychological toll was the isolation of lockdown, separation from loved one, grief for those lost, and the constant low-grade hum of dread. Fear, collective trauma people learn often a cough in a public space was creating a panic. This social segregation was the cruelest trick of this virus. We needed connection to most of the world, felt fragile. That the very foundation of cracking under the strain of microscopic harm. This was not just a public health crisis, it was a crisis for an entire human community. It revealed how vulnerable our complex globalized system truly was. Supply chain broke, hospitals were overwhelmed, and the government were powerless for a time. It felt as waiting for the world was holding for a savior that might not come due to wreckage of normalcy. Grow as institutions faltered, people stepped forward. The chaos of the pandemic became a catalyst for extraordinary act of kindness and solidarity too. The solidarity of people, armies, doctors, small cares were given. Air Navy started grocery chains for the elderly, teachers organized online classes from their own living rooms. Seamstresses started stitching face masks for frontline workers. They were the foot soldiers. Grassroots responses blew. Everywhere in India, Sikh Gadlas ramped up, preparing and distributing millions of meals. In Italy, citizens sang from balconies across empty streets to encourage the health worker and inspired people to fill the gap. Mutual aid networks sprang up across cities nationwide. They crowdsourced funds for families with low income. They arranged childcare. They set up hotlines for emotional support. Citizens started taking responsibility for each other. Powerful decentralized companies not just clarify reclaiming agency in a world controlled, delivering a bag of groceries became concrete, meaningful action. And this inspired entire world. A small victory to erase the pain of the loss, but counter-narrative to fear, isolation in the darkest time. The instinct to protect each other, this actually spread through communities, and light of hope came up. Their own strength, their capacity was helping each other. The connections outlasted, creating a stronger, more resilient relationship. The pandemic tasted the human spirit that rises to meet any challenge. The pandemic was a stress test, and the world's political and social structures begin to break. The crisis did not create new problems, it exposed and accelerated the existing problem, failure, leadership, and many failed things. The virus thrived in indecision, political countries where leaders delayed the truth and prioritized the economy and public health. The virus became pandemic, became a political thing. Masked lockdown became partisan symbols. The politicization was deadly, cowardly, and in the midst of failure, new form of leadership emerged often from unexpected places. Scientists and public health officials were thrust into the spotlight. Dr. Anthony Fauci, guided a terrific pattern for public government and local communities that stepped into the void. They made hard decisions when national leadership faltered. The leadership proved to be competent. Commitment to scientific truth, society began to reconfigure a massive unplanned experiment in remote areas. Employees, employers, offices saw a partial exodus of people, sought more space. Leaving the essential worker was suddenly recognized as the bedrock of society. Grocery stores, delivery drivers, sanitization. The newfound visibility sparked conversation about fair wages, protection, and deep inequalities also. The global order was shaken. Pandemic severed supply chains, sparkled nationalism, countries hoarded protective equipment and later vaccines. The initial lack of international cooperation was a stark failure of global governance. This great unraveling forced a painful reckoning that a globalized world, a crisis anywhere can quickly become a crisis everywhere. This pandemic was brutal lesson in our shared vulnerability, desperate need for a more resilient, cooperative international system. The race for a vaccine was the scientific lifetime. It was a story often told by giant lines of Western Pharmaceutical Pfizer their mRNA technology delivered in record time or monumental achievement, but only part of the story. The global effort was far. Diverse laboratories developing world race manufacturing plant worked non-stop. Scientists and nations forced their own solution. India, the pharmacy of the world, Central, the Serum Institute of India partnered AstraZeneca and the University of Oxford to produce Covishield. This was a core part of the global strategy. Produce massive doses and scale market, making vaccine affordable and accessible across low middle income countries at the same time. Biotech developed a COVID homegrown inactivated vaccine. This pattern repeated elsewhere. China deployed its own vaccine, Sinovac. Sinopharm then became the backbone of campaigns across Asia, Africa, and Latin America. Debates also raged over compared to mRNA vaccine that these vaccines available and prevented severe diseases when Western doses were scarce. Russia's Sputnik 5 also played a good role. It built a more resilient global supply, less dependent on few wealthy nations. These efforts for survival were tried. Wealthy nations engaged in vaccine nationalism, buying up supply from Pfizer, Moderna, leaving others. Institutions like Serum Institute of India and Sinanam responded directly. Inequity, the global south declared itself an active agent. This parallel vaccine race changed global health, creating new centers of power and innovation. Countries that had been dependent on Western companies now had their own manufacturing. The pandemic created a shift toward more distributed health infrastructure, better preparing the world for future pandemics. One of the most profound and startling thing was pandemic as where it hit the many measure of the world's wealthiest and powerful nations. Like USA, United Kingdom, several countries in Western Europe recorded a staggering number of infections and deaths as the world healthcare system pushed to the point. This was shocking turn of events. There were countries presumed to be the best, prepared with the most resources, the most advanced hospitals, and most scientific expertise. However, their failure was a humbling reminder of nature of modern vulnerability. Reason for this paradox was complex. In many wealthy countries, core cultural value which made collective public health measures like masking and lockdown difficult to enforce and easy to politicize, the very freedom and personal liberty and national pride became liabilities in the face of communicable disease. Furthermore, these societies were often mobile and globally connected with dense urban centers, providing the perfect environment for a respiratory virus to spread wildfire. Their social structures built for efficiency to communicate the biological disruption. In contrast, some poorer countries in Africa, Latin America, and Asia fared surprisingly better in this emergency. These factors contributed in this many African nations that had recent hard when managing infectious disease Ebola. They possessed community health networks and public health protocols. They quickly adapted for COVID-19. Population were also significantly younger, average a demographic advantage for the virus, most lethal for the elderly people. The collective responsibility also facilitated compliance with public health mandates. This is not to say that how the virus was spread, devastating waves variants emerged and suffered economic fallout. However, the initial desperation was telling that pandemic preparedness is not just about having many ventilators in hospital. It also led to social cohesion and structure and recent experience with adversity health workers. While a history of different kind of resilience, true resilience was a far more complex and human quality. The virus was not a static target. It shape shifted, it evolved again and again. Mutation, most changes were meaningless, but occasionally, sometimes the virus was an advantage. It made it more transmissible and more lethal, breaking the immune system of entire world. It evolved so relentlessly that humanity was not fighting at all. A constantly changing pandemic became a dynamic high stake dance between human ingenuity and virus evolution, a race we have. The first major twist was the alpha variant detected in the UK in late 2020. It was significantly more contagious than the original strain, and there came a devastating winter surge. The virus could change the game of any moment. Alpha was just the prelude. Then another variant emerged in India and swept the globe in mid 2020, that was 21. It was Delta virus. It was more transmissible and causing more deaths. Delta put the entire world to a halt. The vaccine had arrived, but a glimmer of light was normally. But Delta ripped through populations, causing breakthrough infections. Even in the vaccinated, showing vaccines were not a silver bullet. The goalpost shifted. Victory was learning to live with it, to tame it, and raising inferno into a manageable fire. Then came Omicron virus that was identified in Africa and most healthy, hypertransmissible, spreading with astonishing speed and exceptionally good at evading immunity from prior infection and vaccination. It generally caused less severe disease, its sheer infectiousness to unprecedented waves of cases. Each new variant was a new chapter in pandemic story, a reminder that it is persistent and adaptable 4-hour battle and a sprint, but a marathon with no clear finishing line. The seasonal waves of COVID 19 were more dangerous. It became annual routine. We had entered an uneasy peace with the virus for most. It is now manageable, but it remains a mass disabling event, a silent pandemic that continued to unfold, reminding us of microscopic entity forever for the world.